Welcome back to Smitty's Learning Room. Today we continue to have a look at the HSC option Improving Performance, and we're moving on to aerobic training. Now before you watch this video, it's strongly recommended that you go back to the Core 2 Factors Affecting Performance playlist and watch the aerobic training video from there. It's expected that as part of this option that you have an understanding of aerobic training and the different types of aerobic training, and so therefore it's really important to go back to that video and watch it, and also to revise your aerobic training notes from Core 2 as well before you delve into this video. So when we're having a look at the syllabus, we look at the focus question, the first focus question in the Improving Performance option. How do athletes train for improved performance? And so previously we had a look at strength training, and today we're going to have a look at aerobic training. Now, as I said, it's really important that you go back and make sure you revise and remember having a look at continuous training, fartlek training, and interval training. So the new content in relation to aerobic training that this video will look at is having a close look at measuring and monitoring aerobic training adaptations and the safe and potentially harmful aerobic training procedures. So when we look at this aspect of measuring and monitoring aerobic training adaptations, it's important to have a look at, well, what are some of the adaptations in order to understand how do we measure those adaptations. And so there are many adaptations which should be evident if you're going to engage in aerobic training, and these will vary from athlete to athlete depending on their age and the stage of training that they're at or how long they've been training for. And some of the obvious ones will be, to start with, the increase of heart strength and the ability to pump blood. So obviously the more aerobic training you're going to do, the more efficient your heart is going to become at pumping blood around the body. Now, when we have blood pumping around the body, obviously we then have increased lung ventilation, because we need the lungs to work and to ventilate, to put oxygen in the blood. So therefore, we then, as a result of that, have an increase in red blood cells and therefore an increase in oxygen to the muscles. And so if we have increase in oxygen to muscles, we can then increase our glycogen storage. And then we start to have a look at, well, we've got these increase of heart strength and oxygen in the blood and energy, but what does it do to performance? And so by having an increased aerobic training or an aerobic training program in place, is going to increase the performance duration before an athlete experiences fatigue. So the more they train, the more efficiently they train, the longer they're going to last before they reach that fatigue stage with aerobic training. This is also going to have impact on their resting heart rate, and they're going to have a decreased resting heart rate. In relation to the body size and composition, obviously body composition is going to change a little bit, and you're going to see the strengthening and growth of skeletal muscles. So that's the muscles supporting the skeleton. And you also see an increase in size and efficiency of slow twitch muscle fibres. So now that we've had a look at those adaptations and what are some of the things that can happen as a result of implementing an aerobic training program, it's important to understand, well, how do we actually measure these adaptations? And going back to similar like the strength training, it's important that you conduct various tests at different stages of training, and that those tests should be valid and reliable and target the aerobic system. Now, there's several tests that coaches will do, and they might be tested a little bit more specific to different sports, but some of the common tests that are used to measure aerobic capacity or aerobic training benefits. And this is the multi-stage fitness test, so that's looking at the VO2 max test, or more commonly known as the BEEP test, a 2.4 kilometre run test, so that's looking at how fast and how efficient you can run a 2.4 kilometre run. Having a look at body fat percentage, so we know that as a result of aerobic training, our body fat and body composition will change, and so therefore it should be decreasing. So if you can compare body fat percentages at different stages of the training program, you should be able to measure and monitor the aerobic training adaptations as a result of those tests from body fat. Another test that can be used often is similar to the run test, is a 6-minute cycle test. Obviously, if these athletes may not be runners, they could be doing a different sport, or that's obviously more specific to cyclists to be able to do a cycle test as opposed to a run test. So just like when we had a look at strength training, the safe and potentially harmful aerobic training procedures go hand in hand. So if we have a look at some of the safety elements in relation to aerobic training, obviously by adhering to these elements of training, that's going to avoid harmful issues around aerobic training. And so one of the first things that you should always do prior to actually starting a training program is to have some form of medical pre-testing. And we've learnt that back in the HSC option sports medicine, and having a look at, well, if we have results, medical results or previous history results, the training program can be tailored to the athlete's needs more specifically. It's really important, especially if they're beginning athletes, to learn the correct technique of whatever activity or sport that they're doing, and to sometimes look at the concept of investing in a coach. This can obviously help you receive gains probably a lot faster than if you were just to implement training programs yourself, and can also assist with motivation and that concept of learning the correct technique. When looking at training programs and looking at aerobic training procedures, it's important to include a warm-up and a cool-down always, not just to prevent injury, but also to assist in recovery. And on that concept of recovery, to include rest days within the program. It's also important when looking at your program, if you haven't invested in a coach, to understand the concept of progressive overload and ensure that you are slowly and timely increasing your training rather than starting at a really high intensity with high repetitions maximums or high intervals. So it's just important to understand that concept of progressive overload and starting off slow, and then as the body adapts and makes adaptations, that's when you can start to increase your training load or the speed or the distance at which you train at. It's also important with aerobic training to include cross training to train the whole body. So similar to strength training, where we try to avoid just training one muscle or singular muscles all the time, and look at including training that will train our core strength as well, or our whole body strength. It's important to do that for aerobic training procedures as well, as this not only provides the body with more support, but allows us to see better gains within our training programs. So as mentioned at the start of the video, if you've come through this video and you haven't gone back to that aerobic training and the real basis of aerobic training, you need to make sure that you have a really in-depth understanding of aerobic training in relation to the types of aerobic training, so continuous training, fartlek training, and interval training, and also having a look at the effects on the body from engaging in those types of training. So having a look at what impact those specific types of aerobic training have on improving performance.